Did you know that by the time you finish listening to this audio, around 20 seniors will have been diagnosed with dementia? That's one every 66 seconds. But here's the terrifying part. What if the cause isn't aging, but your medicine cabinet? You've been told these pills are safe, routine, even essential. But new research is sounding the alarm. 99% of seniors have no idea that at least one medication they're taking could shrink key memory centers in the brain by over 28% in less than a year. Let that sink in. And the pharmaceutical industry has known about this for decades. Yet they profit billions from selling the same drugs that may be accelerating cognitive decline in millions of seniors. In fact, a 2023 study in Neurology and Aging Research found that one class of drugs increased dementia risk by 49% in seniors within just 2 years of use. In this presentation, we'll reveal the 9 most dangerous medications triggering rapid memory loss and dementia, ranked from commonly ignored to mind-destroying. And number 3, it's prescribed to millions for something harmless, but it can shrink key memory centers in your brain, and you probably don't even have a clue it's doing it. Let's start at number 9. And don't let its position fool you. This one is in almost every senior's cabinet. It might be scrambling your brain before you even feel it happening. Number 9. Diphenhydramine, or Benadryl. Diphenhydramine is that pink pill millions trust to help them sleep, soothe allergies, or ease cold symptoms. It's cheap, over the counter, and you probably have it in your nightstand right now. You may think you're just taking it to sleep better or relieve allergies, but inside your brain, Benadryl can be disrupting the hippocampus, that is the region responsible for storing new memories. Benadryl is part of a group of drugs called anticholinergics, which block a neurotransmitter called acetylcholine. This is a chemical that helps your brain form new memories and stay alert. The older your brain gets, the more it relies on every bit of acetylcholine it has. And when this drug interferes with that process, the result can be devastating. According to a 2023 study in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs regularly had a 54% higher risk of developing dementia compared to those who did not. So, how can you protect your memory? First, avoid anything with diphenhydramine, especially if it's labeled PM, nighttime, or allergy relief. These are often just Benadryl in disguise. And if you're using diphenhydramine for allergies, there are newer, non-sedating options like loratadine, that 2L, which is commonly sold as Claritin, that do not cross the blood-brain barrier and are much safer for long-term use in seniors. Never stop a medication abruptly, but never assume that over-the-counter means safe. Up next is a drug often marketed as harmless and gentle on your stomach, yet it can interfere with the very nutrients your brain needs to stay sharp. Number 8. Proton pump inhibitors. Prilosec, or Nexium, are medications that belong to the class called proton pump inhibitors, or PPIs. These drugs are designed to reduce stomach acid and are often prescribed for heartburn, GERD, and acid reflux. Many seniors stay on them for years, even decades, because their symptoms return as soon as they stop. But what's rarely discussed is how PPIs interfere with the absorption of vitamin B12, which is a crucial nutrient that protects the brain and supports memory, focus, and mood stability. In a study from 2016 published in JAMA Neurology, researchers examined over 73,000 people aged 75 and older and found that regular PPI users had a 44% increased risk of developing dementia compared to non-users. By suppressing stomach acid too aggressively, PPIs interfere with the body's ability to absorb not just B12, but also magnesium and calcium, which are essential for neural transmission and brain cell signaling. Without them, neurons struggle to fire efficiently, which causes misfiring, confusion, and memory lapses that often mimic the early signs of Alzheimer's disease. But the issue goes even deeper. PPIs have also been shown to increase levels of amyloid beta plaques in the brain, which are toxic proteins that disrupt brain function and are considered a core driver of Alzheimer's disease. The good news is that there are safer alternatives. If you're using a PPI daily, ask your doctor whether you can taper off slowly with the help of H2 blockers like famotidine, which is sold under the name Pepcid. While not perfect, H2 blockers are less likely to interfere with cognition. Also, chewing a bit of deglycyrrhizinated licorice, which is a natural compound that coats and soothes the stomach lining, can offer symptom relief without cognitive harm. Next is a medication often taken for bladder control, but it may be wreaking havoc on both short-term memory and emotional balance. Number 7. Bladder control medications or Ditropan. Oxybutynin, which is sold under the brand name Ditropan, is often prescribed to seniors who struggle with urinary incontinence or overactive bladder. On the surface, it seems like a practical solution. No one wants to deal with the embarrassment or inconvenience of frequent bathroom trips. But this medication works by blocking acetylcholine, the K, which is the same brain chemical disrupted by Benadryl. Unlike some milder anticholinergics, oxybutynin crosses the blood-brain barrier more easily and affects memory regions in the hippocampus directly. That makes it particularly dangerous for seniors, especially when used over long periods. In a 2019 study published in the BMJ, researchers found that people over 65 who took strong medications like oxybutynin for more than 1 year had a 49% higher risk of developing dementia. That's nearly 1 in 2. What makes it more concerning is that many seniors are never warned about the cognitive side effects. They are simply told it will help with bladder control, not that it may accelerate mental decline. The harm is often mistaken for normal aging. Patients describe feeling foggy, forgetting appointments, misplacing items, or suddenly struggling to keep track of conversations. It's rarely linked back to the medication until the damage has progressed. So, if you're taking oxybutynin and you've noticed any mental changes, it's not just in your head, and you don't have to stay on the drug to stay in control. Fortunately, there are newer medications like mirabegron, which is sold as Mirbatriq, that work through a different mechanism and have shown significantly less impact on memory. These drugs do not block acetylcholine and are generally considered safer for older adults. Number 6. Statins. Statins are among the most widely prescribed drugs in the world, especially for people over 60. They are meant to lower cholesterol and reduce the risk of heart attacks and strokes. Simvastatin and atorvastatin, which are sold under the brand names Zocor and Lipitor, are the two most common ones. But here's where the problem starts. Cholesterol isn't just a heart issue. It's a brain necessity. The brain is made up of nearly 60% fat, and cholesterol plays a key role in creating and maintaining the myelin sheath, which is a protective coating that helps nerve signals travel smoothly. When you aggressively lower cholesterol, you may also be starving the brain of what it needs to function. In a 2023 study published in Frontiers in Aging Neuroscience, seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment, and those on high doses had even more noticeable declines. What's even more concerning is that some patients reported sudden onset memory loss, describing moments where they couldn't recall names, recent conversations, or even familiar driving routes. Now, it's important to understand that not all statins affect the brain equally. Some, like pravastatin and rosuvastatin, do not cross the blood-brain barrier as easily and are considered less risky in terms of cognitive side effects. If you've been on a statin for years and you're noticing fog, forgetfulness, or confusion, it might be time to talk with your doctor about a dose reduction or alternative strategy. Don't wait until it becomes irreversible. The earlier you take action, the better your chance of protecting your mind for the years to come. Number 5. Benzodiazepines. These include drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax. They are some of the most widely prescribed medications for anxiety and sleep problems. They work by enhancing GABA, which is the brain's calming chemical that reduces overstimulation. At first, they seem like lifesavers. They quiet the mind, ease panic, and help with sleep. But over time, these drugs become something else entirely: a trap. A 2022 study published in the BMJ followed over 8,000 seniors over a 6-year period and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk went even higher for long-acting benzodiazepines like diazepam, which stay in the body longer and accumulate in fatty tissues, including the brain. What happens is a kind of chemical sedation that slows neural activity. That means your brain stops learning as quickly. It becomes less flexible, less efficient, and more prone to confusion, memory gaps, and emotional dullness. Seniors on benzodiazepines often describe feeling like they're in a fog, disconnected, or just not themselves. And the worst part is when they try to stop, withdrawal symptoms like anxiety, agitation, and insomnia can be severe, making the drug feel essential when it's actually the source of the problem. To correct this, here's what you need to do. If you've been on a benzodiazepine for more than a few weeks, do not stop suddenly. This can be dangerous. Instead, work closely with a doctor to taper the dose gradually. Alternatives like buspirone, which is a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety, can help restore calm without causing memory loss. Number 4. Amitriptyline, or Elavil. Amitriptyline, which is sold under the brand name Elavil, is an older antidepressant that is still commonly prescribed today for pain, insomnia, and sometimes even migraines. At first glance, it may seem like a multi-use miracle pill, but under the surface, it's one of the most potent anticholinergic medications still in circulation. This means it blocks the action of acetylcholine 200, the chemical that helps neurons communicate, form memories, and stay sharp. In fact, it blocks it so strongly that the effects on cognition are not just possible, they are expected with long-term use. In a massive 2015 study published in JAMA Internal Medicine, researchers examined over 400 adults aged 65 and older, and found that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. That's not just a slight increase, that's more than half again the normal risk. What's terrifying is that many of these patients were not told that the drug could harm their memory. They were often prescribed amitriptyline for sleep issues or nerve pain, and then slowly began noticing changes like short-term memory loss, word-finding difficulties, and foggy concentration. It doesn't take a high dose to cause problems. Even low-dose amitriptyline, taken nightly over several years, can create a slow, invisible erosion of brain power. The damage happens silently. No warnings, no symptoms at first. Just a gradual decline that looks like aging, but is actually drug-induced cognitive impairment. So if you or a loved one is on amitriptyline, speak with a physician about alternatives. For nerve pain, options like duloxetine or gabapentin may offer relief without the same level of anticholinergic burden. For sleep, melatonin or low-dose doxepin, which has a much milder anticholinergic profile, can be used instead. And for mood support, there are newer antidepressants like sertraline or escitalopram that are generally considered safer for the brain. Number 3. Paroxetine, or Paxil. Paroxetine, which is sold under the brand name Paxil, is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs. for depression and anxiety. At first glance, it appears to be a modern antidepressant, one that's supposed to be gentler than the older generation of drugs. But here's the part they don't tell you. Paroxetine is the only SSRI that has significant anticholinergic properties, which means it interferes with acetylcholine in the brain. That one detail makes it drastically different from its SSRI siblings like citalopram or escitalopram. In a large 2021 review published in Frontiers in Psychiatry, researchers examined the cognitive profiles of elderly patients taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within the first 12 months. The study also found that seniors on paroxetine were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The irony is that it's often prescribed to stabilize mood. Yet, it ends up undermining mental clarity and emotional regulation over time. The fix here is straightforward but essential. Avoid paroxetine entirely in seniors. The American Geriatric Society has placed paroxetine on its Beers criteria list, which is a list of medications that are potentially inappropriate for older adults. If you're on it, ask your physician about switching to safer alternatives like citalopram or escitalopram, which are better tolerated and don't carry the same cognitive risks. In addition, supplementing with B vitamins, especially B12 and B6, can help support mood naturally. Number 2. Antipsychotics. This one is especially alarming because many seniors don't even know they're taking an antipsychotic. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were originally developed to treat schizophrenia and bipolar disorder. But today, they're frequently prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes associated with dementia itself. That's right. These are drugs that are supposed to be for severe psychiatric illness, but they're being used in nursing homes and hospitals for seniors who are simply confused, restless, or hard to manage. The consequences are devastating. In 2022, a comprehensive study in the Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within 12 months, even if they had no prior history of dementia. Worse, these drugs increase the risk of stroke, sudden death, and severe sedation, which can lead to falls, hospitalization, or permanent institutionalization. The mechanism is brutal. These medications suppress dopamine, which is a chemical that's not only linked to mood and motivation, but is also critical for executive function and memory processing. When dopamine levels crash, the brain becomes sluggish and unresponsive. This is why seniors on antipsychotics often appear dull, emotionally flat, or zombified. Their personalities fade, and family members begin to mourn someone who's still physically present. Correcting this situation starts with asking hard questions. If you or a loved one is on one of these medications, ask the doctor why it was prescribed and whether it's truly necessary. In many cases, behavioral symptoms can be managed with non-drug interventions, creating structured routines, reducing noise and overstimulation, addressing pain or discomfort, and improving lighting and sleep hygiene. When medications are absolutely necessary, lower doses for shorter periods can reduce harm. But more often than not, these drugs are used out of convenience, not necessity. The tragedy is that many families are not even told what these drugs do. They just see their loved one declining without knowing the cause is chemical, not natural. Number 1. Anticholinergic Polypharmacy. This is the hidden danger that almost no one talks about, and it's one of the biggest contributors to drug-induced dementia in the elderly. You may be expecting a single drug to top this list, but the most dangerous medication for rapid dementia in seniors is not one pill. It's the silent, creeping effect of taking multiple medications with anticholinergic properties At the same time, a situation known as anticholinergic polypharmacy. Imagine this scenario. A senior takes diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each one alone may cause only mild memory problems, but together they compound, and the cumulative anticholinergic burden skyrockets. This isn't just a theoretical concern. In a 2022 analysis published in Age and Aging, researchers tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the risk. And here's the worst part. Most of these seniors had no idea they were even on anticholinergic medications. When you block acetylcholine from multiple angles at once, your brain doesn't just slow down, it begins to decay. Neurons wither from underuse, synapses shrink, and the brain enters a hypoactive state that mirrors Alzheimer's. Correcting this doesn't require a miracle. It requires a medication review. Ask your doctor or pharmacist to evaluate your full list of prescriptions, over-the-counter drugs, and even supplements for their anticholinergic load. There are online tools and professional software that can calculate the cumulative burden. Once identified, you can work to deprescribe, slowly tapering off unnecessary medications, switching to safer alternatives, and rebalancing the brain chemistry. This is the most empowering part of this entire presentation. Drug-induced dementia is often reversible. When the burden is lifted, many seniors regain clarity, energy, and memory function within weeks or months. The brain is resilient, but only if you give it a chance. Polypharmacy is not just dangerous, it's preventable, and that makes it the #1 hidden medical threat to the minds of our aging population. Now, we want to hear from you. Which of these medications are you currently taking? Have you noticed any brain fog, forgetfulness, or personality changes since starting a new medication? Are you willing to talk to your doctor this week about reviewing your medications? This information could be life-changing for you or someone you love. Don't wait until it's too late. Thanks for listening.